been a really interesting kind of journey for us at the clinic. I don't know, I'm sure you've probably read my blurb, but basically my background is general surgery, and I spent a period of time researching as well. And I think one of the things when I entered the world of aesthetics that always really unnerved me was the kind of slight snake oil voodoo aspect of things, and the kind of let's just do it and hope it works type aspect. So for me, a lot of the brands that we've got in, or the devices that we use, are steeped in science, and I think that's a really important, powerful part of what we do. It's lovely to see lots of familiar faces here today, some of whom trained me. So yeah, it's, you know, I think it's been a real journey. I started out by injecting and treating patients in our spare bedroom, not to be recommended. I quickly moved on to have a clinic in South East London. Some of my team are here, and you know, I think it's really important to have a team attitude and aspect to the patient care, and that's what we try and deliver. I'm delighted that we've been nominated for Best Clinic in London for the Aesthetics Awards for second year running, so that's very exciting. And it's going to be a good night anyway, isn't it? No matter what happens. So I'm going to start by throwing it out there. So this is a lady who we see regularly, and she's lovely, and she is currently going through lots of personal problems. She's 67, and she came to us really wanting help with the way she looked. So I guess, would anyone dare to kind of suggest or just put their hand up and say what they would do in terms of kind of questions and things that they'd want to know about this patient? She likes sailing. Surprise, surprise. She doesn't use an SPF. Surprise, surprise. Yeah. Yeah. So she has had a good life in terms of expensive holidays, and yeah, sadly it's never kind of manifested in skincare, but yeah. Priority. Yes, priority. So she's now come to us wanting as much help as possible to help her look fresher, younger, you know, and she actually, one of the big things for her was actually pigmentation. And I know a lot of my kind of attention is grabbed by her deep lines and wrinkles, but the pigmentation for me, I think, is something that's very easily forgotten because it's so distracting, those marks. And actually, when you start to do something and offer help for that pigmentation, you really start to make changes to their general appearance. So anyone hazard a guess at some treatments that they might offer her? Yeah, lovely. Yeah, fab. So we actually started her on a course of peels, and we use the Skin Tech TCA pain control peels. This is not actually the recommended kind of frequency. However, her holidays got in the way, so we had to do them a month apart. Okay. Her skin was prepped prior to that with a blending bleaching cream that we've talked about earlier, and we obviously encouraged her to use her Melablock regularly for the period prior to and afterwards as well. We also encouraged her to think about some needling type treatments, and she underwent a course of mesotherapy, and I used RRS, which particularly the whitening mixed with the High Lift 75 Proactive. For those of you, and I will discuss some of the RRS treatment options a bit later, but for those of you who've done any of the RRS treatments, you know one of the beauties of this is the versatility and the fact that you can mix all of these products together to create your own very special cocktail of treatments, which I then microneedled in, and also using a hand nappage technique, I just needled in some tensile lift, just so you know the full kind of coverage of her treatment. And of course, skincare. So between her peels, she was using the Skin Better Science range. She was using Even Tone, the Interfuse Lines Eye, and Alpharet at night. As we know, and we've had lots of lovely kind of scientific information about the topicals, But that interaction between the even tone and the alpha ret at night have a synergistic action. So you're getting a double whammy, basically. And her SPF ongoing. She has had injectables and a treatment with using HIFU and radiofrequency to tackle the deeper skin layers, because I do try and talk to patients about all the 5 skin layers. And these are the sorts of results that we were getting. And she was delighted. My worry, of course, is how long can we sustain them for, given her lifestyle. So a really big part of this is education. And I think, because otherwise they're just wasting their time and money. There's a really big kind of part of our time at the clinic is dedicated to just consultations. And I'm sure many of you have the same practice where you have dedicated consultations only. I don't, as Dr. Mook said, offer treatments on the same day, especially, peels, obviously not, but very rarely, because you do need to have that very honest conversation with your patients. So hopefully, having had a load of science this morning, we're going to talk a little bit more about the clinical aspects and the way we can use these treatments in our everyday practice. So not all of our patients are as confident as Winnie Hollow, as much as I'd love them to be, and to be able to hold up their pigmentation or depigmentation and celebrate it. What does it actually mean to our patients? Well, it's interesting because actually there is actually even a quality of life score, the melasma quality of life score, that has been created back in 1996. There's very little literature actually, and Balkrishnan in 2003 described the quality of life impact of melasma, depigmentation, pigmentation in patients. Very few people actually, and I think, Doctor, you very interestingly talked about it this morning about actually how your NHS practice very rarely sees these sorts of patients, and actually it's us that tend to see it, where patients are describing very, very low self-esteem scores. They ruminate on their pigmentation. It becomes all they think about. And actually, if you do talk to your patients, they do say it's the first thing they think about. I recently treated quite an important influencer, and she, despite her kind of Instagram face, one of her biggest things was she didn't even want her children to see her with her PIH, her acne-related PIH, in the morning in bed. That was the first thing she thought about, was how she was going to cover it up. So it's huge. We treat a fair amount of patients with skin of colour, not a huge amount actually, but the ones that do, one of their biggest concerns is the fact that they're going to end up looking bleached, that they are perceived socio-culturally that they're trying to be white, what are you doing? Why are you trying to be this colour? They often actually, with HQ-based products, tend to go this sort of grey, ashy sort of colour for a little while before they then depigment and even out properly. So there's a lot to talk to your patients about. And of course, the cost, we again heard this morning about patients who they go and see and how many different people they go and see before they come and see you. And they will come to you with expectations and a budget. And often they will have seen umpteenth other people and spent a lot of money. So you have to know what you're doing. If you don't, then just don't waste their time. I think having that really honest conversation saying, do you know what, this is a bit beyond what I can do for you, but I know a really great practitioner who can. Because it will keep your reputation intact and that patient-doctor relationship intact or practitioner relationship intact. And of course, the use of makeup and cover-up is a big problem, and patients will come to you saying, I really want to stop using that. I want to be who I am. I want to just not wear makeup anymore. And of course, the other big thing to consider is what are they doing at home? They're often scrubbing. They're using various mechanical aids to basically stimulate the melanocytes, and the whole wave of hot cloths and cleansing is really, really problematic for pigmented skin. And of course, the biggest problem is a quick fix. Having said all of that, they actually still want you to go, right, here's a cream, use this, and it's going to be magically done, and it's not. So you really, really do need to sit down with them and plan a patient journey. And this is what we take a lot of pride in at the clinic, and we do sit down and map out actually on a piece of paper monthly or 2 monthly or 3 monthly treatments so that they know what, when, and how much they're going to be spending with you as well. It really helps them, and it's very transparent then. Education, as we said, is key. Explaining to your patients why UV, and it's not just, oh, I did a quick run this morning, but it's fine, isn't it? I had a hat on. No, it's really not going to be fine. And also that conversation about, yes, it's a thing for life. You know, melasma is not curable, and it's a really important thing to be honest with your patients about, because their question often is, at the end of that patient journey, what next, doctor? Do I have to use this forever? You know, and it's, well, you're going to have to do something lifestyle related, skincare related for life, yeah, to make those changes and sustain them. Whether it's exogenous or endogenous hormones, you need to have that kind of thought process, as we've heard earlier. And of course, the sort of sun sense approach to exposure to sun. I often encourage patients to think about the reapplication of their pigment control cream alongside their SPF, so you see the two things hand in hand through the day, that they're not just doing one and then that's hopefully okay, and then they've sweated it off, and you know, they need to be combining and being really vigilant with their sunblock, almost having a timer on their phone where they're doing something to reapply their SPF. And of course, the vitamin A at night is really important. I think what's been great for us at the clinic is the alpha rep, because of the very minimal kind of irritation that you see. So as a result, your patients can hit the ground running with that and really get on with using their retinol and getting that into their skin to help with pigmentation. So again, one of the reasons AestheticSource have featured so highly and you know, so repeatedly for us at the clinic is because of the portfolio that we've got at our kind of disposal. You've got the most fantastic range of peels, and we will hear more about those a bit later, ranging right through your AHAs, your BHAs, TCA peels, phenol peels, should you so wish to go that far with your patients. Right through to, and you've got your retinol peels, of course, as well, which are fantastic. They come with your bisbilol, which means that you can actually, you've got a really lovely calming effect. So there's minimal irritation, but maximum results with the retinol peels. And of course, the new kid on the block is the Peel to Glow, the lovely Peel to Glow, where we just love that at the clinic. It's been one of our kind of, it's been a really big kind of success amongst our patients. It's a home peel system. It's not even a system, really. It's just 2 steps. It's really easy. They apply the peel and then just it foams up. It goes on their skin. Leave it on for a couple of minutes. I'll just say, watch a bit of telly. Remember to take it off, wash it off, and then you put on half the bloom and then reapply the bloom in the morning, and then that's you done. And it's a lovely, minimal downtime, but maximum results, as with most of the products that you can see here. On to other treatments in the portfolio. RRS, one of my sort of pet favourites. One of the things with RRS is, I think, the beauty of it is the modalities in which you can apply it to the skin. It literally covers, you can get it in, however you want to get it in, it's what I say. And whatever you've got at your disposal at the clinic, use it. Don't go out and buy fancy pieces of kit. You don't need it. Although Naomi's probably looking at me going, you just did. But anyway, apart from that, you can just get it into your skin, however that patient is ready for, really. And of course, we're going to hear about cysteamine a bit later, I think just after me, and Skin Better Science, a fantastic portfolio. And for me, it's proving to be our maintenance range, really. It's becoming the one that tends to be our kind of ongoing rolling treatment that we can up and down regulate with our patients. But I think the really important thing for me is remembering to review your patients. And again, when I entered the world of aesthetics, I remember thinking, God, how do you know what happened? You know, there's so little high-level evidence. It's all kind of case studies and things. And I think one really important thing for me is reviewing patients, so I'm learning from them the whole time. Because otherwise, how do you know? You know, you give them a cream, you never see them again. They might have got better. They might have gone seen the person down the road. You've got no idea. So I think reviewing your patients regularly is absolutely vital. So back to RRS, because I don't think we've touched on this, and it's beautiful. It basically stands for repairs, refills and stimulates. It consists of a hyaluronic acid usually as its main kind of stay of content, with or without silicium. And on top of that, you then have a specific complex. So it's a beautiful cocktail of products, really. With the whitening, you have got in it, you've got your hyaluronic acid, but arbutin, aminoethyl phosphonic acid, the retinol palmitate, and your Morris alba. And you'll recognise all of these because they're all products that and chemicals that we've heard about earlier. Your licorice extract, your vitamin C, your Glyceria glabra as well. And you can use this directly into the pigmented areas. You can needle, you can microneedle, you can hand inject. However you want to get that into the skin, you can do it. And ideally, you want to be doing 6 sessions weekly and repeating that as a course. So think about how you can bundle that up for your patients and get them thinking more seriously about their skin. So while they're benefiting from the physical potency of a needling treatment, you're also getting something chemical into that deep dermal layer to help regulate melanocyte function. And you can mix it with things as well. And it acts, as we know, there's various pathways, but mostly on your tyrosinase as well, and it will stop that production of melanin. Just to remind you and just to show you how potent it is, and actually this is taken from Skin Tech Pharma, and we've heard about some of the products that are available already. But just to compare, you've got kojic acid here acting on your the pigmented, these little cells which have got pigmentation in them. And you can see here, this is what's happening with your blending bleach. So your blending bleach is actually quite effective at getting rid of, at bleaching the tissue. But your éclairance, which I can never quite say properly, but that's pretty much it. It will essentially bleach, but it's your most potent bleaching agent that we've got available on our in the portfolio, which is lovely. And RRS whitening sits alongside it really nicely, so you can prep your skin really well and then go for it with the RRS whitening regularly. I won't go through these products because we've talked about them. Anna's already talked about them. But just to give you some more case studies, okay, and we're going to end with the case studies just so you can kind of see what we can achieve. So again, another lady, we rarely get ladies like this actually who are really sun-worn, but yeah, she just doesn't know what sunblock is. And essentially, these treatments are 3 TCAs because again, her treatment course was broken up by a holiday. So we had to kind of pause things. But you can start to see these areas of pigmentation that are breaking down. And this is what you see, is this sort of slow softening and removal of pigmentation. And she couldn't tolerate the sort of recommended protocol, which is doing them weekly. So you should really be aiming to try and complete your course of TCA pain control weekly. Again, this lady and her pigmentation, she also had a course of the TCA pain control, some of the RRS whitening as well, and she's been using Peel to Glow at home as part of her home maintenance. I would argue she probably needs more than Peel to Glow, but it's something she liked doing. And this lady, interestingly, was already using the Neostrata Illuminating Serum before she came to see me. But she'd come particularly with her quite significant melasma, and this is taken about a month apart, having had her treatments, and supporting herself with her Neostrata at home. And actually, interestingly, I know we've said that we should be trying to use the whole portfolio from the Enlighten range, but again, your patient, I'd rather they use one treatment for a period of time than walk out with 5. So you need to try and make sure that they're actually going to be compliant with what you've got going on. And this is the lovely Kimberly, who's our receptionist, who we started on Skin Better. And she was really scared and hesitant of having anything, like using anything on her skin, because of her sort of experiences with vitamin A based products and deep, something to even out her pigmentation. And yeah, okay, it's not, completely got rid of her PIH, but, and this is all acne related, it's definitely softened the edges. So this is actually, I've put this one in because this is a week apart, just to show you how little irritation, there's no irritation following the alpharet. And she loved the kind of texture of her skin. It really evened things out. It softened it. And then this is 3 months later, and she was delighted. For her, that's enough, but she didn't expect it to completely disappear. So, and lastly is this lovely lady who is one of our patients who's had benebellum, and she's not been back for all of her treatments, and this has been taken, it's only sort of 10 days post-treatment, and you can start to see, so you can still see there's some exfoliation going on there, but she's delighted because, again, what you can't see is the texture of her skin's improved, but the pigmentation has softened. Those edges, those hard edges of her lentigine have actually started to soften. So thank you, and we're around for questions a bit later, but I hope that kind of it shows you how you can really try and extract different things from the portfolio, put them together, having an honest conversation with your patients, absolutely key, and reviewing them is really important, which I'm sure you know. Thank you very much.